laser does the treatment for the prescription. It's made by a company called LASIK. Most common laser used in the United States. So this is the latest version. It has what's called iris registration, so it registers spots on your iris so that if the eye moves or rotates, it moves with it. So it's very sophisticated, very expensive to maintain as well. We have to have engineers brought in to maintain the lasers.
What's with the teddy bear?
What's that?
What's with the teddy bear?
That's for comfort for the patient.
That's scary.
Someone, I had asked on Facebook if anyone had done LASIK and what they thought of it, and someone replied that their daughter had at a very young age. Is that? Now listen, on Facebook there's wackadoos.
I totally agree with that.
So you never know. This woman could have just been crazy, but is that possible to do it on a young child?
Well, the youngest we really do it on is 18. The reason is because your prescription's changing, particularly when you're a teenager. That's because your eye grows with your body, and you're going through growth spurts when you're a teenager. So obviously you don't want to be doing LASIK on a moving target. In other words, your prescription changing, you don't want to be doing the surgery until it stabilizes, and then you do the treatment. Right? So youngest that we go is 18. Okay. And even then, we need to make sure that the prescription is stable. So if it's changing, the person needs to wait a little older until it's functional.
That happens a lot.
Unless you hadn't done it.
But the teddy bear is so we can blackmail all the men that have the we have the patients hold though that so that besides giving them comfort, it keeps their hands occupied because we don't want their hands up and around their eyes when we're doing the treatment, obviously. So it keeps their hands occupied. And then the laser that's closest to us is the laser, it's called the intralase. It creates the flap. So as I mentioned, we have the laser that's, so it's all blade free. There's no blade. And that laser creates the flap.
So with the laser, does smoke come out? Now I'm asking my
Smoke come out? No.
I'm just wondering.
Burn it up.
These are called cool lasers.
Not like cartoon laser beams.
You know, you were kind of
Because
a little
they're
bit
cool.
freaking out.
The lasers don't heat up the eye. In fact, if they did, we couldn't use them because they would burn the surrounding tissue and then you'd scar the surrounding tissue, so that doesn't work. So it actually doesn't heat the tissue. It's a cool laser. It actually vaporizes the
See, you're
tissue.
welcome. You got good information out of that question. Cool.
I don't know if I'm giving you too much
No, they don't know.
information, but
Once they cut the flap in a person, does the person's vision?
well, I mean, during the procedure, there are times where, I mean, people like you can't see anything anyway without the glasses on. So, but you know, it's blurry during the procedure. There is points during the surgery where the vision goes dark. So that's normal. So we always let the patient know, listen, you know, the vision can go dark now. So,
Cool process.
So anyway, a lot of the other equipment here is we have to keep the temperature and the humidity stable. We also have backup electrical systems, power it down and all that sort of thing. And we can still finish the procedures. Anyway.
What temperature does it have to be at? Just curious.
Well, we want to keep it under 75. The humidity is even a little more critical than the temperature. And humidity is kind of difficult to control here because we're so dry. We like to keep it consistent, and that's the main thing, is consistency.